Good morning, everyone. I'm at CK Birla Hospital with Dr. Rachna Singh
Hi.
today to discuss a very important topic, polycystic ovarian syndrome. 1 in 10 women in India is said to suffer from this syndrome. I mean, even if it may not be a consolation, but the fact is that we can draw strength from the fact that we are not alone in this journey and we have many sisters together with us. Dr. Rachna,
Hi. Hi.
hi. Thank you for joining us today and for
You're welcome.
answering our questions. So, the first question is, why is it that we are encountering so many people today who seem to be suffering from this? And is this a new trend?
All right. So, PCOS or the polycystic ovarian syndrome, it is spurting, especially in the urban area, quite a lot. And it is happening because of two very important reasons. One is our genetics, that is the diabetic gene we carry in our inheritance. And second is the lifestyle, which is changing so much now that all the junk food and the lack of exercise is impacting and bringing this disease up like anything.
Okay. So it's interesting that you said it is lifestyle because we feel that many diseases today are being attributed to the lifestyle that we are leading. So are there any particular thing? Because sometimes we notice even very thin people, they seem to have PCOS as well. So
Yes, so PCO is not just a disease of obesity. Although we refer to the PCO patient as, look-wise very fat or something, but there is an entity called lean PCO also.
okay.
And with this lean PCO, yes, we are seeing the same presentation, but the body mass is much lesser in them.
Okay.
So yeah, that's another presentation for the PCOS.
So taking from your previous answer, so you did
Yes.
mention that it is genetic.
Yes. So it's partly genetic and partly lifestyle. Genetic is something we cannot do anything about because it's there in our genes, but it's the other half which we can really control.
Okay.
So India being a diabetic capital, I'm very sure every household has somebody who has diabetes,
Sure.
and that runs through the families. So that part we cannot control. But what we can do is focus on our lifestyle, and then of course, if help needed, doctors are there for you.
Thank you. So, I have a question from a very concerned mom who's asking, what can we do to keep PCOS away from our teenage daughters?
Okay. So yeah, so that 50% is not what we are focusing on. We are focusing on the other 50%. Very important is the diet. Diet which is good in nutrition, high protein, lots of antioxidants, and a bit control on carbohydrates, especially the refined carbohydrates. These carbohydrates just give a sugar high, and body responds to them in a very negative way. So all the junk food which is based on maida or cool drinks or even the juices which are packaged are not something I really advise. So good balanced diet consisting of proteins and fresh fruits and vegetables and exercise. We cannot miss out on exercise. So
So,
that is
if
very
I change
important.
my lifestyle,
Yes.
can I cure this?
Okay, so PCOS we cannot cure. I cannot say, okay, I'll give you medicines and we'll do this and this will disappear from life. No, we can control it. So there is where we have to be really
Okay.
careful about expectations. We cannot cure it. We can control it, and we can control it forever, which is practically as good as
Okay.
getting us through.
Okay. Okay. So, what you're saying is it's not curable, but it is treatable.
It is treatable. It's
It can be
manageable. It's
controlled.
absolutely manageable,
Okay.
and we can the developing symptoms from PCO is what we can totally treat.
Okay.
So I can promise that I'll make your PCO disappear, but with your efforts in between, we can make all the symptoms disappear and take care of the problems which are coming in the way, which could be by medications and by the lifestyle.
Okay, all right. So, is there any, if I would ask you, what are the 5 foods that you would encourage people to eat so, they can ward off
Okay.
PCOS?
I'll not restrict to five, maybe, but the best five
Sure,
is
sure.
best five is fresh fruits, vegetables, salads, lots of proteins, and milk. So milk is not a no for PCO, but we prefer having a low fat milk. Lots of nuts
Mhm.
and antioxidants. So really a big fan of all the seeds. chia seeds and
Okay.
going for oatmeal at some part of the day. One meal can be oats,
Okay.
and that really helps. So these are the things we focus on and totally avoid breads, biscuits, burgers, noodles, anything which is maida based is what
Anything
we
which is
really
processed as well.
process. Whatever comes out of that dabba is not to be entertained. So we call it crap.
Right.
Food actually is carbohydrate, additive mixed,
Okay.
refined, and processed.
Okay, so
Yeah,
it is called crap
it's
food.
called
Okay.
crap food.
For a minute, I thought I did not hear it right.
No,
Okay.
it goes like that.
Yeah,
So
okay. And how
we
true
just
it is.
avoid it is absolutely true.
Hmm.
Yes, that thing is really not giving us nutrition. It's filling us, yes. It's
Right.
giving us calories so we can go through our day, yes,
Hmm.
and not feel hungry.
So there are
But
different
really-
types of diets these days. I mean,
Yes.
some are called fad diets and some seem to work. Is there any particular diet that you would recommend for a
Okay,
person who's
so
suffering from PCOS?
yeah, if there is immediate thing, I would say okay. So one which supports is a high protein diet, which could be either a GM diet or a keto diet, but not really to go in for that.
Hmm.
Maybe for a very short time, you can try to see what sort of recipes and what sort of food things fit in your lifestyle. Once you've decided that, please go back to being having maybe not 3 but 4 meals.
Okay.
So important is in PCO that you keep eating. Don't starve. Don't give your body a chance to go into a relapse of wanting to have sugars.
Okay.
Keep eating at regular interval. Keep eating the food which gives your body some work to do.
Hmm.
That is fibers. So it will be busy doing work and burning the calories for you, which is very important actually.
Thank you, Doctor. And I would like to remind you, if you have any questions, audience, please do send us your questions in the comment section. Doctor is here to answer your questions. Another popular question that was asked yesterday in the community when we spoke about this was, are there any natural remedies to this syndrome?
Okay. So yeah, we are coming back to the same group. We focus on diet and then exercise. Okay. Uh, Exercise could be anything. Again, I'm not a big fan of telling anybody go for a gym.
Hmm.
PCO is not just that, but also sort of stress which appears in your life can influence the ovaries.
So you don't insist on the gym?
I don't insist on gym. I want you to do whatever you like doing best. If you
Okay.
want to dance, please go ahead. You want to go cycling, swimming, whatever you like to do.
Okay.
Freehand is best at your own time, your own pace, and it should be a mix of all sort of exercises. So do something for the cardiac,
Hmm.
running, jogging, dancing, swimming, everything is good.
Okay.
And then something for your muscles, muscle strength building, so weights. And the third important thing is yoga. Yoga has a very positive effect on PCOS.
Oh, yes, it
There are specific prescribed asanas, poses, and ways to do them, which helps with PCOS. So, in the natural part of therapy, I would recommend to go in for other than your exercising yoga.
Hmm.
So, why I don't say gym is because it creates a stress of going over there at that prescribed time,
Right.
which is not a very happy idea.
But
Although
if
if
some-
you can, if
if
you
somebody
want to,
enjoys it, they
yes,
can,
absolutely,
yeah.
absolutely.
So what-
It's not a no,
Right.
but yeah,
So you're saying whatever they enjoy, but
Yes.
there has to be some
there
kind
has
of
to be
physical
at least
activity.
35 to 40 minutes, at least 5 out of 7 days in a week.
Okay.
That much exercise is doctor's prescription.
So for a person who has PCOS, what you recommend is 5 out of 7 days of activity and a diet which is rich in protein, fiber, nuts,
Nuts, antioxidants, and lots of them.
and to avoid
100%.
crap food
Avoid crap. So yeah, we can initiate this no crap thing.
at home.
Yes.
Yeah, definitely.
Yes.
So another concerned person, member has asked, does long-term PCOS lead to endometriosis?
So anyway, so should I start with the basics of PCOS?
Yes,
Why we
please.
worry?
Yes, yes,
Why we
please.
worry is in the early ages is because the kids are getting irregular cycles and they keep getting too long, and when they get it, it's very heavy. In reproductive phase, we worry about PCO because of the inability to conceive. So infertility is a major uh, symptom with which people present. And in later years, it is not endometriosis, but actually endometrial carcinoma. So it's the cancer of the uterus which we more worry about.
Okay.
PCO and endometriosis are not actually linked to each other, but PCOS later in long term might just be heading on to endometrial carcinoma. So the cancer of the uterus is what we really worry about
Okay.
in the later years of life,
Okay.
post the menopause.
Okay.
And in between phase is something where we need to catch up on diabetes and hypertension, which is seen to peak in people who have PCOS.
Okay.
So yeah, not with endometriosis. Not with endometriosis.
The next question is another big problem with PCOS is the fact that uh, it is more it does a lot to our appearance, bringing down our confidence levels. For example, obesity is attached to it. There is facial hair that a lot of people suffer from. So how do we work on all this, doctor? How do we treat it?
Right. So yeah, PCOS, the presentation itself happens because of the increased amount of male hormone in the body. Usually it is 1% amount, but when it reaches nearly 2%, is practically double. It's 100% rise, and that is what gives a rise in acne, loss of scalp hair, increase in the male pattern of hair, and acne can be easily handled. That is not something, but the facial hair is whatever has happened we can't change. So we really suggest going for like therapies like laser, because appearance really matters, especially with the young girls. Their confidence level should not be affected. One. Second, obesity. So we have a multidisciplinary team work when we are handling PCO. Loop in a dietitian, loop in a physiotherapist or your trainer, and we can really bring down the weight. Third is support system. So when you have three people who are going through same thing and we are there to support each other, that's why we call the support groups as sisters also. I would have loved to show that with sisters.
Okay.
Anyways, and that is really very important to take you through these phases when you start feeling low. Supplements are very important. They will take care of your hair, your skin, your general well-being, and keep you on a happy grounds.
What
rather than
supplements do you
so
recommend?
supplements including lots of vitamins, your calcium, your D3,
Which vitamins?
vitamin B.
B.
So B complex is what is really good.
Okay.
But for your skin, if there is specific area, we can also give vitamin E. Really helps. Retinoids really help with acne and their clearance, and also loop in a dermatologist.
Okay.
Okay, so there are some problems. Yeah, we keep thinking because of PCO and then take it as granted that we are suffering, so we will keep suffering.
So you
But actually,
have been talking a lot about hormones.
Yes.
So is PCOS also associated with mood swings, and
Absolutely.
how do
Yes.
a person suffering from PCOS handle that right?
All right. So now we are moving into the therapy area wherein the doctors can really help. Okay. So I just talked about supplements, and then these hormonal changes. They really, especially the progesterone, they really make you feel so bloated and also set in a depressive attitude. You don't feel like going out, and obviously it's a social challenge, and you start thinking in those terms. So one is to bring those symptoms under control, and then to make with supplements and these drugs, you can get out of that entire loop of feeling depressed. So these mood swings can be controlled when we start you on oral contraceptive pills. They do act as a therapy for PCOS as well as taking care of your mood swings.
Okay. So there is a question from a concerned mom
Yes.
who's asked that they have recommended the contraceptive pills to her teenage daughter, and she does not want to go ahead with this. She says, can she try the natural thing first and bring it under control before she goes on to taking the pills?
Okay. So yes, first step is always natural, which is we've already discussed, diet and lots of exercise and good supplements. But there are problems which can only be treated by medication. One. Second is if these therapies are not working, then the damage done by PCO is long lasting. And we don't want that damage to happen to the ovaries of very young girls. So now that we are seeing a trend of PCO rising, very young kids are coming, 14 years, 15 years. And if we leave them alone for another 10 years without helping their ovaries to be quiet, their hormones to be balanced, and their endometrium to be not overly, exposed to these hormones, then PCO treatment has one of the indicators is to give the oral contraceptive pills.
Okay.
We cannot give endlessly, that's for sure, because the side effect of those pills are quite a lot.
Okay.
But yes, for short-term therapy, definitely, it is one of the indicated medication. So don't hesitate. If your doctor is recommending, don't hesitate. But don't start on your own also.
Okay.
Yeah.
There is PCOS and there is PCOD.
Yes.
When does PCOS become PCOD? Are they same? They different?
Yeah, so it is a part of the spectrum. Actually, we start with PCOD, which is a polycystic ovarian disease wherein it is limited only to the ovaries. And like we discussed earlier, if the entire body starts getting affected and then it starts influencing your blood pressure and your diabetes status and your lipid profile, that is when we start calling it a syndrome. So syndrome is actually accumulation of multiple things which come together.
Okay.
So when we say PCOD, it's only the ovaries and the effect of ovaries, which basically is what we are talking about.
Okay. Going back to your previous answer, you did mention that if the treatment is not being followed, if the medicines are not taken, it can affect. How does PCOS, when not treated, how can it affect us, and what are the symptoms that we can see?
All right. So a PCO is a circle, and the aim of therapy is to break the circle. And this therapy, starting from natural to medication, is what we try to do. But if we don't do that, then circle keeps on continuing into giving more obesity and more symptoms of PCO, which in the younger age group are irregular periods, very heavy periods after a gap of 2-3 months. Problem for conceptions are a lot. Then we just don't know what's going on with your ovulation, and infertility is a major presenting symptom in a patient of PCOS. And if we don't break there also and go on a very tight regime, then hypertension, diabetes, abnormal cholesterols, and heading into.
The next question, doctor, is when somebody suffers from diabetes, there is a meter that we can test it at
Yes.
home. When there is BP, again, you can test it at home.
Yes.
Now, PCOS, how do I know? How do I assess, what my situation is?
Okay.
I know one is ultrasound. I mean, that's how
Yes.
I found out about
So diagnostics for PCO are first of all clinical symptoms. So you really get to know something is going wrong with your body. Then we do the basic tests, which include a hormone profile, including your thyroid, your sugar levels, the prolactin levels, and a basic check on the lipid profiles. Third important thing to do is a clinical thing indicated is an ultrasound. So we line these up and we also test the level of male hormones in the body. So these are the only ways actually we can say.
So
Yeah,
how
we cannot
often-
be sitting at home and doing it,
Right.
but there is a thing which maybe I'll hand over to you, and it's a PCO tracker, and that can give us a real good idea of which way we are heading,
Right.
and also tag on our daily activities.
I think that would be great.
Yeah,
We
I
can
hand
publish it in the
Yes,
community,
sure. You
and
can
a
do
lot of
that.
members can
Yes.
benefit from that. Great. So, doctor, yes, PCOS is often associated with infertility.
Yes,
So,
major presenting symptom actually.
it is a major
Yes.
thing, yes. So, what do you have to say for those who are undergoing that condition?
All right. So this is sometimes the first and the only presenting symptom, infertility, and the couple doesn't even know what's going on till we actually get into and start investigating, and then the only problem picked up is PCOS. Happy thing is we can easily control it. We can easily bring down all the levels, including weight and hormones, to a normal range with your help and with the help of medications, whatever is needed. There's a whole range from anti-diabetic drugs to ovarian stimulating things, and also to make help you with the conception drugs. So PCO in fertility is a 50-50 thing between the doctor and the patient. Patient does half the work, the doctor does half the work, but this is so easily manageable that we tell our patients not to worry. That is one ground where we can really help conceive. It takes time. There's nothing which is very quick fix, but yeah,
But it
fertility
is
can
definitely
definitely
treatable.
be managed. Yes, absolutely.
Great.
Again, we come down to management rather than treatment, so we can manage it.
We can manage it. Right. Okay. So there's a question from a member: How to prevent PCOS? I got to know a month back that I'm having one too. Usually the periods are not regular and hence the adverse effects. In my case, I get periods every 10 to 12 days. What should I do to bring it to normal cycle? It started after my delivery only, and now my son is almost 2.5 years. I've gained a lot of weight, trying every possible thing in terms of exercise and diet, but nothing seems to work.
Yeah, so I'll really suggest we do one background investigation check. Thyroid is very important. It really affects the ovaries. Have a look at the ultrasound also. What's going on with the uterus? Is there something new with happening inside which is giving you the irregular cycles? If that is not the case, then maybe for a few months, like I said, oral contraceptive pills, you can go on them depending on what the presenting thing is. Please don't start on your own, but you can take recommendations from your doctor. That will help regularize your cycles also, and once you stop, the symptoms will definitely be much lesser. So that is the way we go about handling.
Okay. So another question is, I've turned 40. My question would be about her scanty periods. I did show, but I got the answer that I have PCOS. Never knew this before though. Both my pregnancies were smooth right from the conception to delivery. Do I need to worry? Do I need further investigations? I'm a gym person and a vegetarian and always have had periods on the same date. Only worry is the less flow.
Yes. So less flow is not really what we connect with PCO unless there has been a diagnostic test done and you being, found to having that. I will not really say you are in that age group since you've had your normal deliveries and normal conceptions and everything. But if there is an indicator among your tests and your clinical situation which says it's PCO, then I would really, really suggest you go through the entire investigation panel and see, what point is it which is troubling you and making you have lesser periods. So yeah, it needs some more work before we can really give a diagnostic.
Now, since
Yeah.
you mentioned investigation, so
Yes.
this question is about that. How often should we be doing the test, doctor? How often do you
So
recommend?
there are some which are diagnostic,
Mhm.
and there are some which we can follow through to keep a watch on. What we really need to do is the hormone profiles, like I really just now mentioned, the thyroid, the insulin, the prolactin, and the male hormone levels of testosterone and DHEAs. All right. Beyond that, ultrasound needs to be definitely done to give us a view of how the ovaries are behaving. Ultrasound and the basic hormones we can repeat 6 monthly
Okay.
and keep a watch on that. Once we are improving, then we can make it, a yearly, like a routine checkup.
Okay.
If it is not getting corrected, or let us say we are moving into a phase where wanting to have pregnancy, then the hormones will be very different.
Okay.
Done during maybe first second day of periods, and they might need to be repeated more often than when we are doing for a teenage PCOS control.
Yeah,
Yeah,
that's going
so
to be
it
my
is a
next
very
question.
very individual
Okay.
plan we have to make,
Okay. Okay.
depending on the aggressiveness, depending on the response to whatever they are doing, depending on what their expectations are. So if you are wanting fertility, if you're planning for conception, we might do a more tighter control of investigations, so we can change the therapy faster.
So, what are the warning signs now? If a patient knows, or if a person knows, let's not call her a patient because
Yeah.
almost everybody seems to
Yes.
have this. So, when a person knows that she has PCOS, and she's going about with her lifestyle, with her changed lifestyle, but are there any warning signs that she has to watch for and she has to approach doctor immediately?
Yes, absolutely. Keep a watch on the weight. That is very important. Second is your period cycles. So I'm really sure that tracker thing is going to, keep us one step
Right.
ahead of catching that.
Okay.
Even a fresh spurt of acne, that be a first indicator to tell you that some underlying hormone imbalance is going on.
Okay.
So either watch out for your food or watch out for your ovaries. So one thing is giving you the trouble somewhere.
Okay, so acne could
Acne, more of facial hair which is coming in, and your daily sign and symptoms. On these basis only we make the diagnosis and we follow the therapy also.
And for young girls, at what age should we start the testing, and or do we
Yeah.
just watch out for warning
Yeah, we
signs?
watch out for warning
Okay.
signs. If there are symptoms, we treat that.
Okay.
Okay, I would not recommend that you start screening everyone for PCO.
Yeah.
That creates stress, and stress creates so much more problems in PCO than what it was actually where we started with. So
Okay.
yeah, don't get into screening your young daughters so much just because of one pimple or something. But if it is becoming very very rampant and the periods are becoming absolutely irregular, then please do.
Again, it's a very cyclic thing, right?
Yeah.
I mean, does obesity cause PCOS, or does PCOS cause
So both, so
obesity?
that circle, it's a circle and we need to break it.
Okay.
The more the obesity, worse with the symptoms of PCOS. And if we don't handle PCOS, obesity will keep on piling up that fat, which will keep us giving that testosterone, which aggravates the ovarian hormone functions. So we have to break the cycle. Even 10% reduction in the body weight really brings your cycle back to normal. So it is, I'm not saying just lose drastically and become half your size or anything, just 10% of the body weight. And practically all the problems we can sort out.
Great. And your few words to people who are suffering with PCOS.
All right. So first of all, yeah, we are not suffering. We have it, and it's we can easily handle it. It is not difficult. My best thing to tell a PCO person is absolutely everything is in your hand, and then we have enough support therapy to take you out of this situation. So if you are not don't put yourself in a patient category. Don't put yourself in suffering mode. This is a lifestyle thing, easy to manage. It's not something which we really throw our hands and then cannot do anything. So we can really do everything which is needed at different phases of life.
Great, great, great. Thank you so much for the assurance, doctor, and removing the stress from the PCOS, and convincing us that it can be managed,
Yeah.
By lifestyle, taking guidance from our doctors. So thank you so much once
You're
again.
most welcome. You're most welcome. And yeah, one last closing sentence. So we are doing this in the month of September. And yeah, September is the month where it is an International PCO Awareness Month.
So it's
And
perfectly
yeah,
met today.
I'm a great supporter for the cause of PCOS. We go by the teal ribbon,
Okay.
and I hope once we join hands, we can promote these causes also for bigger, better.
Definitely,
Yes.
definitely, it should reach many more
Yes.
women. Thank
All
you
right.
so much.
Thank you so
Doctor.
much.
Thank you for
Thanks,
joining
and
us.
bye.
Bye.